My name is Dr. Mildred Anderson. Woo! And I am a 67-year-old lifestyle specialist, anti-aging and healthy lifestyle specialist. Thank you. Originally, I was born in Birmingham, Alabama, but my parents, before I was 6 months old, decided to move north. That was for economic reasons, and so I was raised in Michigan, in Detroit, Michigan, and was a good student there. About the age of 7, prayerfully, I decided that I wanted to help people. I wanted to become a mother, a wife, a doctor, and a missionary. Now that sounds a little complicated, but I was doing it prayerfully, so I thought it was possible. Along the way, there were people who said, "Oh, sure, that's great. You can probably do that because you're good in school." But there were others who said, "But your father, he has 8 kids, and it's hard to make ends meet. He's a factory worker. How are you going to be able to afford that?" So there were people who encouraged and people who discouraged me. Matter of fact, even though I qualified very easily to get into medical school, there were the doctors who interviewed me, and they laughed when they said that I wanted to be a missionary and give some of my services away, because they said I would have so many loans and so many bills that I would really have to concentrate on paying those off first. But at my first opportunity, when I was a senior resident, and I first went into ophthalmology because diseases and surgery of the eyes was what I thought I could do well. My pathway first went, while I was in medical school, I was already married, and my husband, who was in an orthopedic surgery resident, decided that he really was anxious to have children. And he was afraid that we were getting older and he didn't know if we would be able to have children. So since I was such a good student, I decided, well, okay, my family tends to have babies fairly healthily. I decided to go ahead, and I had 2 children while I was in medical school. After that, my husband, unfortunately, although he got a chance to practice orthopedic surgery for 9 months, he died before I started my practice of ophthalmology. And although I was crushed, since I knew it was a plan I had made with God and that I should continue, and that it was a part of what I was supposed to do. And I had already started my family, so I was able to be at peace with that. And I did proceed, because I'd already gone on my first mission trip to Haiti in 1978. And so I knew that was something I absolutely needed in my life. After going to Haiti 3 times, there was a doctor, Dr. Madi, who came to the area where I was doing some work, and so he worked with me. I introduced him to people in the area, and they began to use him. So I no longer needed to leave my practice in Michigan and come down and help the people in Haiti, because they had Dr. Madi there helping them in the area that I was working with in Haiti. And so for my next mission trip, I went to Africa, where I'd always wanted to travel. And I chose to go to Malawi, Africa, because I had connections through the International Eye Foundation and also with the National Baptist Church. And so I went to Malawi 3 times and had a great time helping people there for about a month at a time, 3 times. And after that, although I took care of my practice, and I would like to tell you that my most famous patient was Rosa Parks. And she was a patient of mine for more than 20 years. And we had an opportunity, since I also did work in the community, of doing things, giving talks to students and community members about how to be helpful to the community. So that was a highlight in my life, besides my international missionary work. I, as a physician in my 50s, got sick. Yes, doctors get sick too. And so my doctor friends were trying to help me get well, But I noticed in my progress that with chronic problems, Western medicine wasn't meeting the full bill of my needs. And so I began to study Eastern medicine. I began to study holistic medicine. And so using more natural means, I was able to get myself back to full recovery. And so now I believe in integrative medicine, to use the best of all worlds in helping yourself to get well and to stay well. So I would like to end my talk with you to just encourage you, while you're trying to develop a career in health perhaps, to make sure you keep your health, that you prevent diseases by living safely, using your seatbelt, not smoking, eating well, drinking lots of water, getting plenty of sunshine, but using sunblock. After at least 15 minutes of sunshine, you should have on sunblock, and also making sure you get plenty of rest and relaxation, at least 7 to 8 hours a night whenever you can. Resting in between, planning your week so that you have times where you are going to have fun with your family and your friends. Having a balanced life is very important. Your attitude, the way you carry yourself, and remembering that you have a spirit inside of you that needs to be nurtured also. So take good care of yourself, and hopefully you'll be able to take care of others too. I'm a member of the T. Leroy Jefferson Medical Society, and the reason we're talking with you today about health careers is because we would like to encourage you to make decisions in your life so that you can help others and perhaps choose a health career. And you can consider all levels, whether you want to be a doctor, a nurse, a radiological technician, whatever part of the healthcare field you want to be in, whatever talents you have, please help, because there will always be sick people and there will always be people that you can help. We need you.